everyone, you are with me, Miss Sylvia MG. Okay, today we learn about English conversation for health, and the topics today is caring for patient after an operation. For the very first, I have a question for you. How a patient might feel after an operation? After an operation, a patient usually feels sick, in pain, uncomfortable, and etc. Here, Miss Sylvie will show you a mind map how a patient might feel after an operation. Check it out. From this mind map, you know post-operative feelings of patient. They usually feel anxious, uncomfortable, sick, in pain, and then why it happened? And then you are as a nurse, what should you do? Try to imagine if you are in that situation. Okay, then open your book on page 17. There is such kind of exercise for you, point C. Just try to do it first. And you can pause this video. Okay, have you done? Mari kita bahas bersama ya. For the very first, after a patient has had an operation, a nurse in recovery checks. Nah, sebagai nurse, setelah patient selesai operasi, gitu kan? Jadi nurse-nya ngapain itu? Ngecek apa itu? Ya. So what is your answer? Okay, let's check it. Start from point A. That the patient has woken up. Apakah ini tugasnya nurse? Ya, bisa jadi ya, mengecek pasien apakah dia sudah bangun atau belum gitu kan, after the operation. And then let's continue point B. If the patient is in pain, ya, jika pasien dalam kesakitan gitu kan. Yes, of course ya. And then yang C, that the patient has ordered lunch ya. Apa ini, memesan makan siang? Apakah ini tugasnya nurse? Ya, of course no. Jadi ini bukan ya yang point C ya. And then yang point D, the patient's observation. Ya, of course ya. Okay, then yang E, if the patient has an appointment for an X-ray. No ya. And then yang F, if IV fluids are running. Yes, of course ya. IV itu apa sih? Intravenous catheter ya. And then G, if the patient is bleeding, ketika pasien berdarah, ya jelas ya, it's nurse ya, tugasnya nurse ya kan. And then yang H, if the patient would like to go for a walk. Sepertinya kalau setelah operasi langsung jalan itu, ya kan mereka masih lemas ya kan. So it's no ya. So jadi apa tadi jawabannya, poin apa? A, B, D, F, and G ya. Okay, then let's continue number 2. How can a nurse check to see if a patient is awake and oriented after an operation? A, call the patient's name, memanggil nama pasiennya. And then yang B, slap the patient on the shoulder. Oh my god, ini anarkik sekali. Kalian jangan jadi nurse yang seperti ini ya. Masa pasiennya ditampar soldiernya ya? No ya. And then yang C, tap the patient hands. Of course no ya. So what is the best answer? Yeah, you know, E. Of course ya. Call the patient's name is enough. Hello, Miss Anna, for the example. Then number 3, where do patients go after they have recovered well from their operation? A, to the intensive care unit, atau biasanya kita ICU gitu ya. Jadi setelah operasi gitu kan, sudah baik gitu kan, masa dikasih ke ICU? Biasanya ICU kan untuk yang gawat-gawat gitu kan. No ya. So the answer is no for point A. And then point B, to the ward, ke pangsal ya kan. Kalau bahasa Indonesia itu pangsal ya. And then yang C, home to their family. Wah, setelah operasi langsung ke rumah? Yakin ya. So what is the best answer? Yes, of course, B, to the ward ya. di bangsal. Okay, next. It's your turn to compare it. In your country or in your place, is the role of nurse in recovery the same as in the book? And then the second, how would it be different for children? Try to answer it and record your answer to measure your speaking skill. Oke, setelah kita membahas tentang caring patient in recovery, so next it's returning a patient to the ward. Jadi kita kembalikan pasien ke bangsal gitu kan. And then, what information might the IC or intensive care nurse give to the ward nurse about the patient? Kira-kira informasinya apa ya yang diberikan oleh nurse di IC? The IC nurse will give information about any difficulties experienced in recovery and also pain management plan ya. Jadi bagaimana manajemen lukanya itu ya. Then open your book on page 19. There is exercise for you. Match the patient statements to the nurse replies. If the patient said, "I'm thirsty," so you are as a nurse, what should you reply? "Oh, I will get you some water," like this. So please record your answer and send it to me, okay? After talking about caring patient in recovery and then returning patient to the ward, and then it's time to talk about pain. Let's discuss this question. For the first, are there any cultural differences? Especially for the patient when they are in pain. Because you know, in some cultures, people may try to put a brave face and pretend to be suffering less than they really are. We usually call it as macho attitude, where men are expected to be strong and not to complain. Beda ya sama cewek gitu kan, yang apa sedikit complain, "Nurse, I feel like this, I feel like this, please help me," and etc. But when men feel in pain, like it's okay, I'm okay, like this. Okay, we are going to the second. How might you talk about pain with children? Yeah, of course, yeah. When we talk to children, of course, with different treatment, right? We can use picture, toy. For example, point on Teddy where you feel the pain. Ya, jadi kita gunakan mainan, ya kita gunakan picture like this. And then the third, what colloquialism are you familiar with? Ya, ini maksudnya perkataan atau ekspresi yang menunjukkan pain itu bagaimana gitu kan? We can say like this, "My hand is killing me. I'm pain double with pain." And then open your book on page 21. There is exercise for you. Try to do it first, okay? Okay, have you done? Okay, here I give you the answer. You can read it by yourself. And then after this, there is such kind of challenging thing that you have to do. What is it? Check it out. Nah, share your knowledge. Show your opinion, record it and send it to me. There is a quote for nurse in the world. Every nurse was drawn to nursing because of a desire to care, to serve, or to help. Okay, I think that's all. Thank you for watching.